Hello, welcome to the Healthy Alternatives podcast. I am Dr. Christine Sauer with DocChristine.com. Today's show is a recording of my radio show of the same name. Enjoy! Good afternoon, this is Dr. Christine Sauer, your host of the show Healthy Alternatives here on 97.5 CIOE FM with live stream on communityradio.ca every Thursday at 12 noon Atlantic Standard Time. Thanks for tuning in today. In this show, I will talk mostly with guests about all aspects of health, healthcare, and wellness, from conventional to alternative and everything in between. My mission for this radio show is to help change people's lives for the better by informing them about different options to get and stay healthy and well so they can choose for themselves which option might work in their case. And if you feel you are stuck in a dark place, I want to tell you, don't give up. There's a light at the end of the tunnel for you too. Today, I'm very pleased to be with Janice Burgess. Janice is a quit smoking coach with JB Quit Coach, a clinical pharmacist, a certified health coach, and welcome very much to my show.
Thank you, Dr. Christine. I am very happy to be here.
Hi, Janice. I'm so happy that we got together and we talked before, and I'm very excited about sharing the news about that it's important to quit smoking. Now, let me know who are you and why did you get into this quit smoking thing?
Right. Well, because I'm a pharmacist here in my province, one of my jobs that I was fulfilling was as the director of professional practice for Pharmacist in Saskatchewan. Mm-hmm. And one of my first roles was to get the quit smoking program up and running for pharmacists in our province. And then it progressed into me doing a lot of one-on-one work with clients to help them quit. Creating some online training and online quit smoking programs so that people can really get the information or the options that are available to them right from the comfort of their own home, basically. And so I have a couple of online courses, but it really goes back to, my passion for helping people quit smoking goes back to my father, who died when he was just 56 years old of lung cancer caused by his smoking.
Oh,
and
I
often think, wow, if I'd only talked to him back then, if I had only known back then what I know now about helping people quit smoking, he might still be alive today, and I miss him every day. And so I don't want others to, experience that same loss. These are our friends, our loved ones, our family. And really, quitting smoking can be a lot easier than people think it will be.
Yeah, I know people always feel quitting smoking is an impossible task.
Yeah, I think that's because they've been kind of told that, but it's really not true. In fact, most of the people who I assist to quit smoking, they say to me soon after they've quit, how they say, well, that was really easier than I thought it was going to be. So that's what my role is, to kind of help be their thinking partner so that they can come up with their own personalized quit plan. And then it just works, right? Because it's very doable for them. So what do you tell clients why they need to stop smoking? Well, usually we'll start with sort of the benefits specific to them. And there's benefits in every case, but often people don't really draw the connections between their smoking and what might be going on with their health or their wellness at the moment. It could be something as simple as not sleeping well. Well, smoking interferes with your sleep patterns. And so what we do is we try to discuss what's going on for them and relate the benefits to quitting specific to them.
Well, that is extremely important to do it in an individual case. So from your rich experience, what are the most common symptoms that people have that they never thought smoking would cause?
Oh my goodness, there's so many.
Go for it.
Well, anything from any part of your body, actually, like your eyes. People who smoke are more likely to have glaucoma or cataract. Your hair and skin, you'll wrinkle faster when you're a smoker than when you're a non-smoker. If you think about your teeth, your dental health, there's so much going on in tobacco and even chew tobacco that affects your dental health, and good dental health is important to your overall health. Obviously, your heart, your lungs, every part of your body is affected by smoking, and so getting people to realize how they would personally benefit, and there may be several ways they would benefit, is a huge first step. So we uncover why they smoke and then what to successfully do about that and how they would personally benefit. And it might be money. Smoking is very expensive. You know, what would they like to do with that extra money? There's clearly lots of other things that they could put that money towards that might make them feel amazing, so much better.
That is a wonderful approach, because most people, when they think of the money they could save, they don't realize what all they could do. And many people don't have no idea what they really want to do in their life. They just go day by day, and smoking might calm them down. That's one of the common reasons.
Yeah, a lot of people use smoking to relieve stress, but there really isn't anything in that cigarette that reduces stress. The thing about it is that when people are faced with a stressful situation, though, they fall back on what they know and what they've always done. And for smokers, that's often smoking.
I just wonder, could it be sometimes that when they try to stop smoking, the nicotine withdrawal gives them the stress they need to have another cigarette?
Well, definitely the up and down levels of the nicotine in the body they can sort of bring on stress even. So, our body gets addicted to nicotine very quickly, and it only stays in the body about an hour or two. And so as soon as it's wearing off, our brain is already thinking about, when am I going to smoke my next cigarette? And, people will create stress, or they'll feel stress when those levels are lowered. So it's the nicotine that gets us addicted, but it's not what causes the harm to our bodies, right? It's the other 4,700 plus chemicals that are in a lit cigarette that actually cause the harm.
So you really get poisoned by each cigarette you smoke.
Absolutely. And 60 of those 4,700 chemicals are known to cause cancer, right? So it's the nicotine that keeps us smoking, that releases that dopamine and makes us feel good for a short period of time, but it's all the other chemicals that cause the physical harm to our bodies.
Wow. Now, the other 4,600 something chemicals that you didn't mention as causing cancer, did they even get studied for it?
Well, there's great research that shows that sometimes these chemicals are added to the tobacco. Sometimes they are added as flavoring. Sometimes they're added to get people addicted faster. Sometimes they're added to puff up the tobacco. So it seems like there's more. So it's really, a cigarette is a very finely tuned drug delivery device. It's meant to deliver that nicotine to our brain quicker than any other drug of addiction.
Wow. Yeah, that's interesting. So the nicotine delivery from a cigarette is faster than even from a nicotine patch, is it?
Oh, absolutely. Now, nicotine replacement therapies, they are helpful to help people quit smoking. There's a certain set of questions I'll usually ask a client to determine whether drug therapy might be helpful. But really, the drug therapies they really just help with cravings and withdrawal. They don't make us quit. And, but they help with cravings and withdrawal, and those are the two biggest reasons people slip or relapse or go back to smoking. The thing is that, they never work as quickly as a cigarette, or get to our receptors as quickly as a cigarette would, but they do in fact help with cravings and withdrawal. I have many clients who quit without any drug therapy at all, though. It's totally their choice.
I think if the motivation to quit is strong enough, they will quit. And
yeah,
I find many people try to quit 10 times and they still keep trying and trying. I think sometimes they are looking for pity.
I don't know. It's an extremely strong addiction.
Yeah.
I think they are possibly using cigarettes to treat some sort of emotion or feeling. They may be missing out on what they really need. That's totally true. But in our coaching sessions, we go through how to keep people on track, how to recognize self-sabotage when it comes up for them, and what to actually do about it, because it comes up for everyone. It really does.
And I think that's a very important part of the quitting smoking journey. Many people just don't have the willpower in apostrophes to just quit. It's not that easy.
Yeah. They may not have a solid plan in place. And that's really my job, is to get them to think about a solid plan, to put it into action. Not everything works every time, but then we readjust and change things slightly or tweak them slightly so that it does work. And if they do have a slip or a relapse, we get them right back on track as soon as we can. I don't want them to think of a slip as either they smoke or they don't. I want them to think of it just as a slip and be curious about why they grabbed that cigarette in that situation.
And that is so similar really to emotional eating, isn't it?
Yeah, very much so. They're using the cigarette. Tobacco and nicotine is a drug, and so they are using it to treat something. Let's get to the bottom of what that is, and let's find out what they really need. And
I think we'll talk a little bit more about that issue in the second half of the show. We'll slowly go to the end of the first half of today's broadcast here on 97.5 CIOE FM Community Radio. Please tune in after the commercial break for more about how to quit smoking with Janice Burgess. Thank you. Hello and welcome back to Healthy Alternatives here on 97.5 CIOE FM or on the web at communityradio.ca. I'm your host, Dr. Christine Sauer, and today I'm talking with Janice Burgess. She's not only a clinical pharmacist, but also a certified health coach and a quit smoking coach. So we're talking in the first half a little bit about quitting smoking. First, welcome back, Janice.
Thank you so much, Doc.
Just call me Christine. I'm fine with that. And tell me a little bit about what the success rates are, because many people try to quit smoking on their own. Yes, they see the money they might save. They might want to travel and they think, hey, what do I need a coach for?
Exactly. I think people don't realize how much more successful they will be when they partner with a coach that can help them quit. So the usual quit rates, when people just quit cold turkey, no support, no help, are about 3 to 5%.
That's nothing.
Now it's great that they're still quitting, but by partnering with a coach, even a healthcare provider who knows a little bit about helping you quit smoking, your success rate usually jumps up to 20 to 25%. When you partner with a certified quit smoking coach or health coach, it actually jumps up to 35 to 50%. And those are certainly the quit rates that I'm seeing. And this is their quit a year later when I check in with them again. So
yeah, that's the numbers we really have to look for, because after a quit smoking program, most people just stop for a while and then it creeps back up.
Exactly. So we want to keep people on track long term. We want them to quit smoking for good. And so we give them all the tools and tactics that they'll need to really succeed. And there can be little changes as well, things like not smoking in your home or car. That one little change can make you more successful at quitting.
And it's so important for the air quality in your house and car, because indoor air can be the worst.
Absolutely. It protects you, it protects your kids, it protects your pets even, if you do not smoke in your home.
And I mean, a recent event in Western Canada and even in the Western US are those forest fires, which is basically a giant smoking thing.
Yeah, the air quality is huge, a huge concern, especially with people who already have some lung issues, right?
Yeah.
So we want to protect people. We want to prevent lung capacity from getting any worse. We want to improve effectiveness of everything else that's going on that they might be taking medications for. Definitely there's benefits to quitting. Even within 20 minutes, our body starts to heal itself. Our bodies are amazing things.
Yes.
And like within 20 minutes, your heart rate drops to a normal level. Within 8 hours, carbon monoxide levels drop in your body and oxygen levels increase.
Many people don't know that with cigarettes, they have a slow form of carbon monoxide poisoning.
Yeah, it's true.
Yeah.
And within 48 hours, your sense of smell and taste gets better. Within 72 hours, your lung capacity increases and bronchial tubes start to relax, and making it way easier to breathe. And almost the little cells in your lungs start to wake up and they're going, hey, wow, this is awesome. But they do start to clear mucus and some of those things too.
Yeah, and that's important because many smokers have no idea that when they smoke, they kill those little hair cells that transport the mucus out of the lungs and the nose and set themselves up for not only emphysema, which ends to oxygen and a slow and very uncomfortable death, for lung cancer, of course, but also for chronic sinus infections and lung infections.
Yeah, absolutely. In 2 weeks, the nicotine is kind of completely removed from your body.
Wow.
And within 3 months, circulation improves and your lung function increases by up to 30%.
How long does it take until your body is the same or quite the same as a non-smoker?
Well, in a year, your added risk of coronary heart disease is half that of a smoker's. But in 10 years, your risk of dying from lung cancer is cut in half. And in 15 years, your risk of dying from heart attack is equal to a person who has never smoked. So there's healing going on all the time.
And that's wonderful. And I don't want to overlook the wrinkles and yellow teeth that really make a smoker stand out. And I don't know how they can stand getting more and more ugly just from smoking.
Yeah. Oh, yeah. I've just touched on a few things, but there's benefits throughout the body, as I mentioned.
Wonderful.
So, yeah. Now, people are more successful if they partner with a quit coach. We're sort of like the cheerleader, tough love person that they need to support them. And I'm able to help give them some suggestions on what might work better this time. Make them more mindful about their smoking. I don't know how many times people who smoke light up a cigarette and they've already got one burning in the ashtray. So they clearly didn't crave that cigarette that they lit up. It was just out of habit and they weren't thinking about their smoking. I teach them how to be more mindful so that they really assess what the cigarettes are doing to their body. It's all about thinking about yourself as a non-smoker now and changing the way you approach it.
And that's important because many people get so used to having that in between their finger and having that kind of pacifier between their lips. And they have to have some replacement. What about people being scared that they'll gain weight after they stop smoking?
Yeah, it can happen. It doesn't happen all the time with everyone, but the most weight people will ever gain usually is about 10 pounds. And you would need to gain 100 pounds to have the same harmful effects of smoking. So I often tell people, if you gain a little bit of weight, don't worry about it. We'll get you to quit smoking, and then we'll work on your next health behavior change. You're going to have a new baseline a new healthier baseline without the smoking. And that'll just give you the energy and the oomph to really work on the next thing, which is eating healthy and losing that extra 10 pounds.
No, that's a wonderful thing to do, because in the end, the people you coach get all over healthier, right? Oh,
yeah. Yeah, they feel amazing. They're able to sometimes come off some of their other meds. They feel really proud of what they've accomplished. They really do.
And they have every right to, because quitting smoking is not that easy.
Yeah. Well, in our sessions, they learn how to reduce and control cravings and withdrawal, and we uncover what has been stopping them or slowing them down or keeping them from releasing this addiction. And we also develop a powerful vision of what being tobacco-free can look like for them. So one of the exercises that we do is breathing pleasure into being tobacco-free. I think people haven't really even conceptualized how amazing they're going to feel.
Yeah, some people, they love the breaks they take at work, and sometimes smokers take the privilege of taking a break every half hour, which makes non-smokers say, hey, why can they take a break every hour and I can't?
Yeah, I suppose there's some feelings about that might not be that great, but, and I don't know exactly what the data is around more breaks for smokers than non-smokers, but I do know that, even a really good, healthy workplace support group where tobacco cessation is included, it promotes the health of everyone at the workplace. And so things like that are a really great idea. And there's a way to incorporate smokers and non-smokers into a healthy workplace plan.
It sure is, and it's very important. Now, why don't you share a link before we end the show to talk about how people can reach you, maybe get on your online program, or even talk to you as a coach?
You bet. So my website is jbquitcoach.com. So there's a way that people can contact me right from that website.
Now, what was it again? JB Quit Coach, one word?
Yeah, all one word, jbquitcoach.com.
Okay.
And then just click on the plan or click on contact me. At the bottom of the plan page, it outlines some one-on-one coaching I can do with people, but it also provides a link to the Breathe Easy Bootcamp, which is an online program. And it's a series of videos people can watch. It goes through how they can personally create their own quit plan that's effective for them. It takes about 2 hours to watch the videos. You can do it from the comfort of your own home. And honestly, it's really easy to listen to and incorporate some of the tips and tools that are provided there into your personalized quit plan.
Now that's so important. And you also have a Facebook page. What's the name of that page?
I do have a Facebook page. It's called Janice B. Quit Coach.
Okay.
That people can visit. And then for people who aren't quite sure they're ready to quit yet, my Facebook page is called On the Fence.
Aha, so if you're not knowing if you want to quit or not and want to maybe find some more reasons, you can just search for On the Fence in Facebook and you will find her page, and probably you can contact you on that page too.
Absolutely, yeah. There's no pressure. It's just the fact. I'm just here to support a really good plan to succeed this time like never before.
Now, that's a wonderful thought to bring us to the end of today's show. Thank you so much, Janice, for talking to us today.
Thank you so much for inviting me.
You're so welcome. And please don't hesitate to contact me with any questions, thoughts, comments, or suggestions. Or if you would like to contact Janice and forgot her links, my email here is christine@communityradio.ca, and I'm always grateful for any feedback. I also want to extend a special thank you to today's producer, Seth Glasgow. Thanks, Seth. You might not know this, but this is a volunteer-run non-profit radio station, and we even have an art gallery. If you're local and you'd like to drop in, we are at 11 Glendale Avenue, Lower Sackville, Nova Scotia. And we even also have a performance hall, Gallery 97. We have music shows and talk shows. Thank you all for listening to Healthy Alternatives. I'm your host, Dr. Christine Sauer. Tune in next Thursday at noon on 97.5 CIOE FM Community Radio with live stream on communityradio.ca for the next episode. Goodbye and have a great day.